Welcome back to McLaren Port Huron's Today's Health Program. In this segment, I'm speaking with radiation oncologist Dr. Neal Bhatt about radiation therapies for lymphoma. Dr. Bhatt, thank you for speaking with us today.
Well, thank you for having me.
Now, you are a radiation oncologist at the Karmanos Cancer Institute here at McLaren Port Huron. Let's start with, what is the goal of radiation treatment for lymphoma?
Well, like Dr. Salasawa has already kind of told you about, lymphomas in general are cancers of the lymphatic system. So the lymphatic system is the part of our body that brings fluid in from our fatty tissues and muscles and brings it back to our heart. The word lymph in general in Latin just means water, and so all that fluid that's getting carried back to the heart primarily consists of immune cells, white blood cells that go around our body and they attack any bacteria and viruses that are hiding. Those immune cells sometimes go haywire and grow out of control and then get stuck in a bunch of bean-shaped organs that we have all over our body, the lymph glands. And most people know about lymph glands because anytime you get sick and you push on your throat, you can kind of feel those little sore nodules everywhere. Well, that's where the cancers show up. And so when most people think about lymphoma, they think about Hodgkin's disease. And the reason they think about Hodgkin's disease is because it kind of affects a lot of different people. It occurs in what we call a bimodal distribution. So, 20-year-olds get this disease, and then when you're middle-aged, you don't get it for a long time. And then when you hit 60, you have a good chance of getting it, and then it goes back down. So, it affects young kids that are in their 20s, and then it affects kids or adults that are in their 60s. And if you look back and if you were to Google Hodgkin's disease or Hodgkin's lymphoma, what you'd see is these 20-year-old kids with big bowling balls on their neck. And that's what kind of got people interested about Hodgkin's disease in general, because it was so visible. You could walk around the street and you could see someone with it. So for a radiation oncologist, Hodgkin's disease is actually a really interesting disease based on its history. In the late 1800s, X-rays were first identified and discovered, and then by 1901, 5 years later, we were already using radiation treatments for Hodgkin's disease. Someone pointed at a radiation beam right at the disease and watched someone's neck mass go away, and it was a huge flurry in the medical community. So Hodgkin's disease is particularly interesting because for the first part of the 1900s, we were using just radiation treatments for it, and we were treating a large swath of people's body. We were treating both sides of the neck, the center of their chest, underneath their armpits, along their sides, going all the way down to their groin and along the edges as well. So we were treating pretty much the full body on people. Anywhere you had a lymph gland, we were treating them with radiation treatment. Around the 1950s, we found out that nitrogen mustards, just like nitrogen gas that people used in wars, works on this cancer as well. So we started combining both radiation treatments and these nitrogen mustard treatments. So I guess what we use with radiation treatment now is a focused treatment to zoom in on those areas where you get those big boulders and try and shrink them down and prevent them from coming back in that area. And then the purpose of the chemotherapy would be any microscopic cancer cells that are floating around in your body would be killed, and that way we'd both take care of the big boulder or the big neck masses, but then we'd also take care of the little microscopic disease that's floating around.
Now, what type of radiation therapies are available for both Hodgkin's and non-Hodgkin's lymphoma?
Well, the good thing about this disease is all the progress we've made. So every 10 years we've made big junctures in care. If you look at the amount of people that are around in the 50s, 10 years after treatment, it was, 50% of people would live 10 years after they got diagnosed. In the 60s, it was like 55%, in the 70s, 60, and every 10 years it's been 5 or 10% increase in the length of time that people have been around. And that's a function of a few different things, one of which is our chemotherapies have gotten a lot better. So in Hodgkin's disease, we figured out new therapies, not like the initial nitrogen mustard that I was talking about, that's very effective and that we can use a low dose of. That's also allowed us to go from treating people's whole body with radiation treatments to just focusing on a smaller area. So because this disease is so radiosensitive, meaning that it only takes a very little bit of radiation to shrink these down pretty significantly, we treat them with a standard photon treatment. That's what we use for most cancers. And the same holds true for non-Hodgkin's lymphoma. But the reason that technology has become so important in this disease is because the new systemic therapies, the new chemotherapies and medicines that are available are able to do such a good job of shrinking the tumors down. It's our goal to treat the least amount of tissue that we possibly can. And so we pretty much use all the technology that we have available to us to figure out how to do that. Now, external beam radiation is what we primarily use, and the way we do that is we have people come into our department, we lay them flat on a table, we get a CT scan of just the area that we want to treat, and then we draw on it on the computer. We draw the lymph glands where the cancer is or used to be. We draw the heart, the lungs, people's voice boxes, their spinal cord. We draw it all out, and we tell the computer we need the radiation to go exactly where we want it, but then avoid all those places that we don't. And so that's kind of the start of how we approach our radiation treatments.
So the external beam radiation sounds very specific to only those cells that you want to kill instead of affecting other areas of the body.
That's absolutely right. So what we're talking about is Hodgkin's disease is particularly interesting because we often treat a 20-year-old kid. And so we know that 20-year-old with current survival rates may be around 50, 60, 70 years later. And so it's our goal to minimize the amount of harm we do to that person because we don't want our radiation treatments to cause someone a cancer in the future or lung problems or heart problems in the future. So really it's about minimizing the amount of radiation that we can give someone and then also focusing on treating the smallest possible area that we can. And we do that a few different ways. One way is when we get that CT scan that I mentioned to you, we actually watch the way people breathe. So we're getting scans while people breathe so we know where their heart is, their lungs are at any given time. So we can make sure we focus on that tumor only when someone's heart or lung is in a specific position and nowhere else. We also do things like treat different areas with different doses. So radiation is kind of like a beam of light, where at the center of it, it's very bright, but then it kind of fades out at the edges and becomes a little bit less bright. So we have to figure out a way to pinpoint it without letting that beam get too wide, and we use a lot of very special techniques to do that.
Now, what might the patient experience during this process?
Well, the very fortunate thing is, since we're not treating a lot of area and we're not treating it with a lot of dose, most people will do very well. The tricky thing is that Hodgkin's lymphoma and non-Hodgkin's both can affect a lot of different areas. And the reason being is that, like I said, it's a disease of your lymphatic glands, and you have them everywhere. So some people will have a lymphoma that exists just in their groin, and others in their neck, some actually even in their stomach. And so what we do is a lot of the side effects will depend on where we're treating. If we're treating an area of your neck, you probably won't expect much outside of some skin redness, itchiness, and dryness, and maybe even a little bit of sore throat. Fortunately, that lasts for a very short amount of time and then fades away. If we were to treat your stomach, you may notice a little bit of nausea that would last for a week or two and then slowly fade away, and kind of a similar type of thing if we're treating your groin.
Is it necessary to have multiple treatments, or is it kind of like a one and done?
For this type of disease, what we tend to do is we break it up into small little pieces, kind of like a savings account, where over 3 weeks we put a quarter in every single day, and on a day-to-day basis it's not very much and most people don't notice anything. But then by the end of the 3 weeks, it's a lot, both in terms of how much radiation we gave you and how durable and how curable it's going to make the situation.
Doctor, this has been great information. Do you have any closing comments for our viewers?
Well, I think lymphoma is a really difficult subject to talk about, and Dr. Alsawa did a great job. One reason why it's so tricky is because of the number of different types of diseases that exist in lymphoma. You know, it's not just non-Hodgkin's lymphoma and Hodgkin's lymphoma. When you talk about non-Hodgkin's lymphoma, for instance, we're talking about probably about 20 different diseases that sit within that category. And some of those diseases need only antibiotics to be cured. In fact, some lymphomas that happen in the stomach or in the eye only need antibiotics and they disappear on you. Other lymphomas just need to be watched because they're not going to cause any people any problems. Some require just radiation treatments. Others require a combination of chemotherapy and radiation, and some actually require a whole bone marrow transplant. So we're talking about a whole range of diseases, some of which are not a big deal at all, and then some are very serious. And I think what you get here at Karmanos is that the medical oncologists, the radiation oncologists, the pathologists, the radiologists, and the surgeons all work so closely together in the cancer center that we can discuss things together and find the right treatment for people.
Dr. Bhatt, thank you for sharing this information with our viewers today.
Absolutely.
And thank you for watching. If you have questions about today's topic, you can email us by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.